I didn't see that.
All right. So keep up with all the hip latest stuff like that. All right. Good morning.
Good morning.
May we have your legal permission to broadcast this interview across the United States and around the world?
Yes.
Yes. Okay. Good. You want to say hi?
Hi.
Okay. And who's here with you today?
This is my best friend, Carrie.
Good. And you guys are from California?
Yes.
We are.
Okay. Do you feel like saying anything about your experience or no?
That's fine.
You sure?
Yes.
Okay. You had a LapBand.
I had a LapBand placed 2 years ago.
Yeah. And then it had some kind of erosion or infection and had to come out as an emergency. Yeah. And so now we're going to give her the good stuff today.
Yes.
Good.
Looking forward to it.
Yesterday you went through clinic
Yes.
and saw a bunch of patients who've had the surgery and all. And is that okay with you?
Yeah, it was helpful to see that people had come out of surgery well.
And any questions that we should have answered yesterday that we forgot, or anything we should go over that you thought we kind of skipped over? Or?
No, I think you covered everything really well. I mentioned to you after that I went into this thinking this was sort of it's a really private issue in some ways, and at first I wasn't crazy about the whole group idea, and I thought it was incredibly beneficial. And at first when she told me she was having it, I was very apprehensive, and I'm so glad I got to come and be educated about it. And so I think that I think it's wonderful.
Well, again, we have to be very sensitive to this issue of dragging you out in front of everyone. You know, that's very different. And again, it's against the federal law. There's a federal law that says the foundational principle of American healthcare is privacy. And so that privacy is really sacred to the way we practice medicine in the United States. On the other hand, there's lots of times when we do group things. As an example, when you are preparing to have a child, you know, that's a celebratory time, and you meet, and everybody who's pregnant gets together, and they talk and educate themselves. When you're dealing with alcoholism, you know, people get together and they talk about the difficult battle of staying away from alcohol. They've done studies with women who have breast cancer. And they had two groups, those women who went through normal treatment and those people who had normal treatment plus meeting in a group with other women who had breast cancer. And the women who met in a group actually live, on average, longer. So there is something about opening up and talking about your experiences and helping other people. It is sometimes intrusive into your personal life, so anyone can opt out of this experience. But I think by getting to know everybody else here this morning, to see all the different people from all the different walks of life that have all kind of struggled with obesity, not been able to successfully treat it, up to and including a surgical procedure like the LapBand, and are here kind of making the same decision this morning, and people from all across the country, hopefully that makes you feel a little more comfortable and confident and will help you get through this better. So.
Yes.
And I think even more so having the people that had the surgery a week ago.
Right.
That was really neat seeing them, and that they all got through it.
And hopefully, you know, not that we wish this, but they all had, you know, little stories of little bumps.
Right.
Hopefully not too tragic, but we had it, as we talked about. There was the lady who had the nausea, and she said, I threw up for a day, I think she said. And Kim, who said, I wish I'd never left the hospital. I was in terrible pain for, I think she said, a day. But then we had other people who were out and went to Boulder Dam and different things like that. And Robin, who was at a show every night. And then we also saw a good example of someone who demonstrated something important for all of us to know, and that is that going through this, we expect with the weight loss, we're going to drop your abnormally high estrogen level back to normal. And by dropping that, you may have a period of kind of tearfulness or sadness or irritability. And so we want to be there for you so you don't have to suffer through that, but we can come in kind of like the cavalry and get that estrogen patch on to help you smooth through this transition in the same way someone who's quitting smoking might use a nicotine patch to kind of transition in a more gentle fashion. And so I think we saw Georgia yesterday was talking about that experience, and she was a little tearful. I got a nice email from her last night. She said, nothing more than patchworking. So hopefully that's educational, because you actually saw somebody who was in the midst of that, and she was a little tearful, and